Hello again, and welcome to this Lifestyle Medicine from the Inside Out microlearning series, where we're looking at this connection between positive psychology constructs and the pillars of a healthy lifestyle and part of lifestyle medicine. And we make the case that positive psychology is a very foundational to what we're doing in lifestyle medicine and healthcare more broadly. And in this segment, we are going to take a very brief look at substance use. We are all familiar with the association between substance use and poor mental health, especially when it's overuse or misuse of substances chronically, or sometimes even for short durations. And the idea is, of course, for example, alcohol, that it's a central nervous system depressant. So by definition, it's going to impact our mental health. And the idea is that maybe we can use positive psychology to help counter that poor mental health and avoid individuals turning to substance use. Sometimes they're turning to substance use because they're having anxiety, stress, and they're having a difficult time managing their lives, and they're using these substances to escape from unpleasant and negative life experiences. So can we boost positive experiences to counter this process? And some researchers in this area are unpacking that, and they're looking at constructs or elements of positive psychology, such as positive future visioning, visioning a positive future that has life purpose, that has good work and meaningful work, that has pleasant experiences and positive social relationships. That if we can help individuals even find a few kernels of positive futures in their lives, that can be a keystone to help turn them around from maintaining these substance use habits, or at least minimizing or reducing the use and minimizing harm from this kind of substance use. So positive psychology can really empower individuals to look at their lives through a more positive lens, look for what's pleasant, what's engaging, what's meaningful, through short gratitude practices, through positive connections with others, altruistic interactions, and much more. And being aware of what's going well may be a great trigger for them to not have to lean back on their substance supports. Substances can often really get in the way of individuals achieving their goals. And even while they are stuck in a substance use pattern, they realize that, but they are looking for a support system. And certainly counselors are there, family and friends can be there. And then if we can offer up these positive psychology constructs and activities, that can be very powerful. In addition to that, if an individual finds that their whole world is crumbling and maybe they're not seeing enough positive there, and they're going to revert back to some addictive patterns, that another linchpin or tool in the positive psychology milieu is leveraging character strengths and helping individuals look within and honestly evaluate what they bring to the table in the form of strengths of all kinds, but particularly character strengths are studied in positive psychology, and how they can use those character strengths to boost their well-being and empower themselves to move forward in a positive way. And a lot of these kinds of activities can be done in self-initiated programs online, so that there's a avoiding of stigma of traditional therapy, particularly if we're looking at mild to moderate misuse of substances. Someone is aware, but they just really need a little extra help. Then they might be able to manage that on their own. We're not talking about major addictive disorders that really do need the intervention of the substance use specialists and mental health specialists. And so in our repertoire within lifestyle medicine and other primary care settings and other settings, being able to offer up and suggest resources online, digital community programs that include and incorporate positive psychology intervention can be very effective framework in helping with addiction prevention and also addiction treatment, especially when we're talking about mild to moderate cases and situations. It'd be lovely to see more research in this area where we are more proactively leveraging these positive psychology interventions in primary care settings and looking at the long-term outcomes. So I'd love to see that. In the meantime, please do consider the repertoire of positive psychology in your Healthy Lifestyles Lifestyle Medicine Toolkit. Thank you for listening, and I hope to see you on another one of these segments. Take care.